86% of organizations value professionals that upskill to advance their careers. It's never too late. Enroll for a self-paced online course today and get to enjoy a 10% discount. Our courses are monitoring, evaluation, accountability and learning, water, sanitation and hygiene, disaster risk reduction and management, food security and nutrition in emergencies, procurement and supply chain management, human nutrition and dietetics, maternal and infant young child nutrition.
Thank you everyone for joining this webinar for today on SBCC. We are truly happy that you put in the time. I know it can be morning, afternoon, evening, from wherever you are, and just taking in this 1 hour to just join this session, it is truly appreciated. Our webinar for today is Empowering Local Voices, Locally Driven Approaches in Social and Behavior Change Communication. So with that, I think we would want to be able to start. As you all, I believe, are aware, my name is Sheilah. I'm part of the academics team here at Humanitarian Global. Basically, what I do is I'm in charge of educate from the academics point of view. So anytime you register a course with us, you will be able to find me there to be able to assist you throughout your study session with us. So I'll want to also give a chance to other people to be able to introduce themselves, people who've made it a success, who've made this webinar a success, basically part of the Humanitarian Global team. Others will not be able to speak because they're currently working on it. I'll also want to give a shout out to Babulo Bekele. Thank you so much for joining from Ethiopia. Yes, Thierry, we have officially started the webinar. We have Girma Goshime from Ethiopia, who's the Managing Director of Pod Nutrition. Thank you for joining this session. We also want to appreciate and acknowledge Thandie Mchiswe from Malawi. So put in your shout outs on chat and I'll be able to mention you guys. So with that, I think I'll invite my colleague Anthony to just introduce himself and then we can be able to proceed. Welcome, Anthony.
Thank you, Sheilah. Hi, everyone, and thank you so much for joining. My name is Anthony from the Academic Support Team. So happy to be part of today's event. And we look forward to interacting with you more. And also feel free to invite your colleagues, your friends to be part of today's event. I'll be back shortly. So thank you so much. Back to you, Sheilah.
Great. Thank you so much, Anthony, for that. And then I can also invite Brian Kavuwa. Kindly introduce yourself. I know you have a very big session coming up, but then let's just get to hear your voice as we look forward to see what you have in store for us.
Thank you. Thank you, Sheilah. My name is Brian Kavuwa. I will be guiding the conversation today on the empowering local voices, locally driven approaches in SBCC. So yeah, currently I'm working in the humanitarian space, and we shall be interacting more. So I'll be sharing more information about myself before the end of this 1 hour. So thank you very much, Sheilah, and much appreciation to Humanitarian Global for giving me this opportunity to engage and discuss on this very important SBCC topic. Thank you very much.
Good. Thank you so much, Brian. And we do look forward to really see what you have in store for us. With that, I think I will want to give you a program of activities. So what will happen is I will bring back Anthony to just give us any new updates that is currently happening at Humanitarian Global. Please keep a close eye on what he has prepared for us. Then after that, we will bring in our expert for today, who's going to give his presentation and his talk just to be able to enlighten us on what is happening around the topic that we have in question. And then from there, we'll also have a session on question and answer where we get to ask live questions. So if you have any question pertaining SBC, this would be a great time for you to have them ready. We'll also have a chance to just give you guys a chance to ask the questions live, as well as there's a section there on Q&A. Please, if you have any questions as he is also presenting, please make use of that so that now you get to ask all the questions that you have in store. So we'll be answering the Q&A as you move and also at the end of the session. So with that, I think I'll want to bring on board Anthony to be able to give us updates from Humanitarian Global. Welcome.
Thank you so much, Sheilah. Maybe you can confirm whether you can see my screen. Supposed to be sharing the website just to make sure that.
Yes,
good.
We can see your screen.
Okay, that's okay. So thank you so much. I intend to take like a max of 5 minutes. And this is to share with you upcoming events at Humanitarian Global. Sorry. And to start with, as we focus on communication today, where we're going to be talking more about social behavior change communication, I would like to say that we have a detailed 1-month course on social behavior change communication. And that is what I would like to share with you, so that if you're interested to join the detailed and further training on the same, you can join our class of October. So as you can see on the screen, this is our website, and quickly on how you can navigate and register for these upcoming training workshops. We have this tab here for train and learn with us. You'd see there's a section for workshops. That is where you'd see, you'd find these short trainings, and there are quite many, but today I'm going to be focusing on the one on social behavior change communication. So we have that being listed there. And as I did mention, this is a 1-month course. And being a 1-month course, we do meet, we do two sessions in a week. So that one session is 2 hours long. So we meet twice in a week. And that is for a period of 4 weeks in 1 month to make sure that we can cover quite much when it comes to detailed concepts in this area. And the good thing, we also do ensure that we can train these courses from a practical perspective. So by the end of this training, you'd be very good when it comes to creating, designing messages for effective communication so that you can drive change to support your interventions, your initiatives that you're doing. So with that said, if you would want to access more information on what we cover in this course, you can be able to click on that link, and then it's going to open to a page where you can find more information. So this is including the objectives of this course, the training outline. And if we can quickly have a look at the training outline here, you'd see that this is a course that is designed to ensure that from the basics, you can be able to build up your skills in this field of knowing how best you can design your communication campaigns, do your campaigns, and communicate effectively so that you can drive change of behavior. So the first module there, it's about introduction to social behavior change communication. And you can see we start from the basics, from the definition, evolution, characteristics of SBCC. We look into the essential steps when it comes to communication, how to plan, and also looking into the principles of social behavior change communication and also the strategies. We talk about the C planning process, and we start by looking into understanding the situation. We also look into the people context and summary analysis together with formative research. So that is the first module. In the second module, we look, as part of the C planning, we look into focusing, designing, and creating messages here. So I know this is quite interesting, where we get hands-on on how you're supposed to design and create messages, and this is towards your campaigns. So we look into communication strategies, we look into the audience segmentation, we look into the profiling, the priorities, and how you go about it. We also look into the barriers and facilitators to change as part of the second unit there. We talk about the communication objectives, we have the strategic approach, we have the channels, the activities and materials mix. We look into the refinement and the presentation of communication strategy. In addition to that, we also look into creating effective materials and also how to do the concept testing and also pre-testing. So you can see module 2, it's quite detailed, and this is a module that is going to equip you with hands-on skills when it comes to social behavior change communication. In the third module, as part of the C planning process, we look into implementation and monitoring. And as part of this one, we look into the overview of the implementation plans. We look into the planning activities. We talk about the budgeting aspect, which is also quite important. We also look into considerations when implementing SBCC programs. And then finally there, we look into the aspect of monitoring. So as you do your campaigns, monitoring is quite key. So how do you go about it? So those are some of the many questions that we try to answer in that particular module. In the final module here, we talk about the evaluation and also the replanning. And here we look into the M&D for social behavior change communication. And also now we try to benchmark with the case studies and also looking into emerging trends when it comes to social behavior change communication. So based on today's webinar, we might not be able to cover extensively when it comes to this concept. I would urge you, try to register, be part of our upcoming class. And as I did mention, it's quite flexible for you. It's not going to disorient your schedule because we do the classes in the evening, a period of 2 hours, a duration of 2 hours each and every day, twice in a week. So that would mean that it's easy for you to plan for that class. So with that said, we look forward to having you join us for this course. Feel free to interact with us in the chat section. Let us know your details so that we can follow up and guide you through the completion of your enrollment for this course. So the training fee for that 1 month course is going to be 300 USD. And we do encourage you, come train with us. We want you to be an SBCC champion. So with that said, maybe how to register, you'd see there's an option here. You can register as an individual. You can also register as a group, and you can be able to follow the steps there and be able to complete your enrollment. So with that said, thank you so much for your attention. And maybe just before I hand it back to Sheilah, I would also want to say that we do also have other upcoming events for the month of October. So if you'd want to hone your skills when it comes to proposal writing. So that is how to write a winning proposal for donor-funded projects. You can also be able to join our class of October. We do also have further training in data collection, data analytics. You can find all the information there, fundraising and resource mobilization as well, and also leadership and project management. So we are here to support you and guide you through the enrollment process. In case of any questions, feel free to reach out to us. So thank you so much, and back to you, Sheilah.
Great. Thank you so much, Anthony, for those updates. I believe we've picked them. If you still have any questions, comments, or clarification, please drop them on the chat section and we will be able to answer them as we move along. I want to give a shout out to Praise Ndembele from National Council of Disabled Persons of Zimbabwe. Thank you so much for joining. We have Rahma Idris as well. We have Rahila Midala from Nigeria. Thank you everyone for joining and just making the time. I'll still insist, as Anthony had mentioned, if you have any colleagues, friends who are interested in SBCC, this would be a very great session for them to be able to interact with us. With that, allow me to hand over the session to Brian Kavuwa, our expert for today. Welcome, Brian.
Okay, thank you, Sheilah, for that opportunity. Just to converse on this particular discussion on empowering local voices, locally driven approaches in SBCC. So allow me to share my screen. Just to mention a little bit about myself is that to this discussion and just to reflect on the experience that I bring on board, I bring on board over 14 years of experience in the space of SBCC programming, project management, MIL, which is monitoring, evaluation, accountability, and learning, and also now recently the discussions around localization. So I'll be glad to take us through this conversation. And it is actually quite a packed conversation, although I'll try to be within the time limitations for this webinar. So I will, start off with the definition of the context and the focus of this conversation. And then, of course, I will also highlight the multi-layer approach to locally led SBCC programming, and then the intersectionality of SBCC and localization, and then a brief highlight of the key elements and the benefits of locally driven SBCC approaches. And then, of course, I will also scan through the global localization frameworks and how they interlink with SBCC programming. So I'll highlight several case studies on localized approaches in SBCC in Africa, particularly in Kenya, in Nigeria, and another one in South Sudan. Then I'll also share some recent trends that we might need to pay attention to when you're talking about empowering local voices and employing locally driven approaches in SBCC programming. And then, of course, just something about what we need to do looking into the future of SBCC programming. So that is pretty much a very clear and direct agenda for this conversation. So just there's a story that is commonly told in Kenya that in Western Kenya, there was a development partner who was involved in water programming and particularly in provision of access to safe and safe drinking water. So this particular development partner went to the community and hired enumerators, research assistants to collect data. So they collected data and then did the analysis and found out that women within that community were walking close to 10 kilometers to go and fetch water. So they sat in a boardroom, very well ventilated boardroom, and decided actually providing water closer to these communities might be the solution to the problem that we're seeing in this community. Okay, so they went and started the process of procurement, installation, and drilling of boreholes of water. And then after some time, once the water sources were functional and accessible to the community members, they went back to check the progress of the project. So and they realized that the women were still not utilizing the water sources closer to their homes. So they went to find out what exactly was happening. So the women were still walking the distances they were still walking to go and fetch water. Okay, so so on a closer conversation, they realized actually the distance was not a problem to the women. In fact, the women were actually enjoying walking the distance from their homes because they wanted to go and gossip. Okay, so so the usually the aspect of the local community, which is always overlooked when we are designing programs, projects within the community, the socio-cultural aspects of that particular community you are intervening. So that was quite evident that they did not actually pay attention, keen attention to the socio-cultural aspects of that particular community. So why are we having this conversation? It's because from the local communities, that is where the actual work is happening. From the very, very very low level of the community levels, that is where actually the change is happening. So that's where we need to focus as we design our SBCC programs and any other programs. So allow me to just highlight briefly the focus of this conversation today. So we are going to look at how the role of locally led SBCC initiatives in fostering sustainable behavior changes within communities, and particularly in humanitarian development context. So that will be the focus of this conversation today. And we highly encourage that if you have any question, any clarification, please just drop it in the chat box so that we will be able to respond to them as we progress. And then, of course, also we'll be glad to hear, to get to know that from which country are you joining us. So just drop a text in the chat box so that we're able to follow through. Thank you very much. Allow me just to provide the contextual understanding of the discussions we are having today. I think it's also good important to bring into context locally driven approaches. What exactly are they? And in this conversation today, we are looking at strategies and initiatives that are created, led, and implemented by local communities. So here we're talking about bottom-up approach, okay, but not the political approach that we're discussing. So here we're discussing about bottom approach where the needs and aspirations of the community that you're targeting to intervene in, they're actually considered in the design of the program that you want to implement. Okay, so and this is basically emphasis on decision making and giving them space to make decisions based on their the solutions they want to actually undertake, and then prioritizing their needs, and then of course developing solutions and sustainability of the whole process, which is all about ownership of the process. And then of course, we're talking about utilizing local knowledge, and local knowledge, you're talking about indigenous knowledge. You'll realize the majority of different communities in Africa, you'll realize they actually have a lot of enormous indigenous, knowledges, and particularly in areas of response to, humanitarian crisis, on how to, to provide the solutions to development needs in their communities. And there are also existing community resources and capacities that they actually do. I will highlight just one definition of SBCC, and I'll pick on FHI 360. And just to make it very easy, is that social behavior change communication, it's research based. Okay, so this is data driven. So you must have data to inform the design of the program that you want to implement in a particular community. Okay, and then you deploy communication strategies. Okay, to promote changes in the community. Okay, so based on the data that you collect, formative research that you carried out, from what Anthony was sharing earlier on the modules that you under the SBCC training, is that these formative studies that you have to carry out, and some of this would be through key informant interviews, focus group discussion, so where you're able to collect credible data from that particular community, and then you're able to design the SBCC program that reflects the aspirations and the needs of that community. Then, of course, addressing the social norms within that particular community and the environments that facilitate those changes. So yeah, so there are several, there are multiple approaches, multiple levels for SBCC programming, and most of the time they're usually a combination. So SBCC can be delivered through mass media, community level activities, and this is where community leaders bring people together, the community members together. Interpersonal communication, this is one-on-one communication and engagement and advocacy to achieve the goal of the SBCC program. So in a nutshell, if you don't remember everything, just get to know that SBCC programming is strongly founded on data-driven processes where you use data to design the SBCC program that reflects the aspirations and the needs of that particular community that you're working in. So let me also contextualize the conversation around localization. And the K International defines localization as a process of shifting power, okay, decision making, and resources from the international NGOs or international actors to the local and the national actors. Okay, so and it involves strengthening the capacity, and it's good also to notice that here we're not talking about capacity building. Okay, we're talking about strengthening the capacity of local organizations, and this is very deliberate because for far too long there's been an assumption that local actors don't have capacity. Okay, so here it's an appreciation that local actors actually do have capacity, and particularly in the response to humanitarian crisis from their communities, which they have done for far too long. So and as this conversation evolves, we will also realize that there will also be a need of two-way accountability mechanisms to ensure that locally driven SBCC programming actually reflects the aspirations of the community members. So localization, it's about strengthening the capacity of local organizations and communities to lead humanitarian and development efforts in a way that is sustainable and contextual. Contextually relevant. And we talk about contextually relevant, it's about respecting the values and practices of particular communities within the areas that you're working in. So very important. So if, to remember this discussion about localization, shifting power, decision making, and resources. Just three very important aspects from the local actors to, from the international actors to local actors and national actors. Within the communities that you're working with. So that's very important. So I also want to invite us to this discussion on the approach to locally led SBCC programming. So there are three layers or three components that I'm going to invite us to, to look into. One is community engagement and participation, inclusive design, empowerment, and feedback mechanism. So locally driven SBCC approaches or programs should ensure that the community needs, they are very central in the design of the interventions that you want to implement in that particular community. So there has to be an inclusive approach. And then, empowerment, strengthening the community. There has to be that kind of approach. And then provision for feedback and mechanism. And this is whereby the international actor has to create space for feedback from the local actors on how best to improve the SBCC program from that community. The second approach is that the contextual relevance and adaptation. Every community has their own cultural uniqueness and diversity. So it's also very important as you're designing, locally driven SBCC approaches or, programs to ensure that you're culturally sensitive to that particular community. So very important to ensure that. And then appreciation or integrating indigenous knowledge from the local actors. Because if you're saying for far many years, these particular, communities have actually responded to humanitarian crisis. They have designed, programs or responses to development needs in their communities, on their own. And and it's also a good for the international actors also to appreciate that. Yes, sometimes these local actors can actually bring, can actually be of value in the design process of the SBCC programs that you're designing in the community. And then adaptation to local challenges. So it's good also to create a plan in anticipation of what might, might not work in favor of the SBCC programs, and develop the mitigation plans to address those particular challenges. And then the third approach is sustainability and ownership. So once you strengthen the capacity of local actors, so like for example, Care International in Kenya has been very, strong on strengthening systems and within women rights organizations in the country through a program called Women Voices and Leadership. So, and this has actually gone to the extent where, the nascent organizations whom did not have very good structures when the program was starting, they do have the capacity, they do have the confidence to approach the different donors, the different organizations to seek for funding and apply, and actually successfully being able to seek for funding. So that is very, it's a very highly recommended approach when you're talking about locally driven SBCC programming. And then local leadership. This is basically also talking about succession planning. Sometimes you'll have local actors, local organizations, which have been, established, within a particular individual. So when you have, a plan where there is a succession planning, that the organization can actually exist even in the absence of the founders of that particular local organization, then that is it's an approach that needs to be considered when you're designing SBCC program within the community. And then institutionalization, and this is basically ensuring that functions, systems within that particular organization, they can actually function even in the absence of a particular individual that within that particular organization. So this is ensuring that the systems within that particular organization, they actually function. And then allow me to bring in on board some key elements, just a few. I will not be able to go through all of them. Some key elements of locally driven SBCC approaches. As I've also highlighted earlier on, is very important to engage the local community in all the stages when you're designing the response to a particular problem within that particular community. And also, I've sat in the recent past, I've also been in a conversation where we were discussing about crisis modifiers. And this is basically when you're budgeting for humanitarian response. It's also good to consider flexibility in financing, in response to emergencies within specific communities. So that is also something very important to also look into, and also getting the views and aspirations of that particular community, and ensuring their voices and perspective shape the SBCC approach. Very important. The next element that I would want to bring on board is that local media, we've also seen, and during the response to COVID-19, we saw a lot of utilization of local media, in the different countries, not just Kenya, in the different countries in Africa and beyond, where local media, the radio station, use of influencers as part of local media, being able to influence behavior in our particular communities. And then of course, use of or influence of local leaders and champions. And this is basically engaging respectable local leaders or community gatekeepers, religious figures and influencers to advocate for positive change, behavior change. And like, for example, if you're talking about biodiversity restoration, and this basically, environmental management in particular areas in the country, like there's a case study somewhere in one of the counties in the country in Kenya, where there was a problem with the sand harvesting. So for that response to be, successful, there was a need to involve the local leadership from that particular county, so that the community can actually appreciate the importance of environmental management and then biodiversity restoration with that particular community. So that usually it's a very important element to consider when you're designing your SBCC approaches within your communities. Then culturally appropriate messaging, very important to respect and to take consideration that different communities, different people have different values, have different beliefs, and everyday experiences. And it's very important to ensure that they can actually relate to the SBCC program you're designing to respond or to intervene in that particular community. And then co-creation, very important. I implore the international community, from the global north, INGOs, to consistently ensure there's a collaborative process when this design ongoing for projects, also, co-creation or co-working during the implementation phase and during the evaluation of SBCC intervention. So it's very important because at the end of it all, it's about ensuring that the programs that you're designing, they're actually acceptable within that particular community and they're actually sustainable. So it's a rallying call to the INGOs and local actors, because I know most of us, if not all of us, probably they're working in some of these spaces where INGOs are also supporting, a lot of local actors, from different countries. So it's very, it will be very great that you create space for the co-creation process, so that the aspirations and the needs of the communities that you're working for, or you're working to change their lives, their views, they're considered during the design and implementation and the evaluation phases of these interventions. Then capacity strengthening and exchange. Yeah, so sometimes a question is always posed on if you're carrying out, capacity needs assessment for a particular organization. The question is always who defines the key, key performance, the indicators to, to assess. Are the indicators co-designed with the input of the local actors? So that's a question. Okay. So in this particular element, it's also a rallying call to ensure that the contribution of the local actors or the local organization, they're actually involved or in place to ensure that even when you're carrying the capacity assessments, so that you identify the needs of that particular organization or the needs of that particular community, their voices, they're also part of this process, and so that you're not, carrying out capacity strengthening, trainings for a particular community for needs that they do not identify with, in that particular community. So it's very important. So this is a rallying call also to the INGOs. And then accountability. Now, sometimes local actors would say, there's so much that we need to do in terms of accounting to the INGOs, and then some will tell you, it's so hectic, we do not even understand some of these processes. So this is also another rallying call to ensure for INGOs to create space for two-way accountability, where even the local actors also can post questions, seek for clarification when need be, in terms of accountability and throughout the process of the SBCC program implementation, so that each partner is responsible, to each other for the actions and decisions, the programs that you're designing, and this goes a very long way in strengthening and building trust and transparency in the partnership. Where local actors also can hold, high NGOs accountable for respecting their values and their needs. Allow me to highlight just 3 benefits of locally driven SBCC approaches. The first one is enhanced effectiveness, messages that resonate with local values, and customs are more likely to change behavior. So it's about changing behavior of the communities that we are targeting through SBCC programs. So when the SBCC programs are locally driven, they're locally driven by the communities that you're intervening in, then you're most likely going to achieve enhanced effectiveness. So, and then most likely change of behavior within that particular community. The second benefit of locally driven SBCC programs, the second one is adaptability. Locally driven approaches, they're more flexible and can adapt to evolving community needs and issues. And then, of course, strengthening and fostering local leadership. So this approach is actually, empower communities by, strengthening their leadership at their local level and decision-making abilities. And this is basically creating agency. And agency is about the ability of the community to create change or to agitate for change in that particular community and seeking for accountability. So it's about strengthening local leadership from the community level. So very important. If there's a problem with access to water in that particular community, do we have leadership to agitate for change in that particular community? Then through the locally driven SBCC program, are we able to design messaging that appeal to the need of that community based on the existing local leadership structure in that particular community? So very important to highlight that. So allow me to highlight just 2 global localization frameworks and how they interlink to SBCC. So I'll pick on the first one is Charter for Change. Probably some of you might have interacted with the Charter for Change, which was launched in 2015. And just to simplify what Charter for Change is, it's a commitment by international non-government organizations to shift more power and resources to local and national organizations. Just that. Just you don't have to struggle, remembering on so many other things. It's a commitment by international, non-government organizations to shift more power and resources to local and national organizations. So I'll pick on there are 8 commitments within that Charter for Change commitment. So I'll just highlight 3 of them that have close correlation or interlinkage to SBCC programming. The first one is about increased direct funding to local, actors, and it is targeting at least 25% of the total program budget. So this commitment is very important in building local capacity or strengthening the local capacity for SBCC, because at the end of the day, if you're talking about strengthening the capacity of local organizations, so there will always be a need for financial resources and technical resources. So it's very important. So that is the first commitment that interlinks with SBCC programming. The second one is the reaffirmation of partnerships. And in this, it's about supporting and appreciation that local organizations and including women rights organizations through equitable partnerships in SBCC programs, interventions. So it's very important to appreciate and support and ensure there's a two-way, accountability mechanism in the partnership, so that we're able to build trust in that particular relationship. And then the third commitment is advocacy for better support of local actors. And this is where the commitment speaks to, or the Charter for Change speaks to international actors being, advocating for locally led initiatives that focus on grassroots behavior change efforts. And I highlighted that one of the success stories of the Women Voices and Leadership Project within Care Kenya is that there has been deliberate support in terms of supporting the local women rights organizations or women-led organizations, where there's been linkages created between those local actors and potential donors. And there has been a lot of documented evidence that they have, their capacities through the institutional strengthening through the program has actually led to, being able to apply for funding from other donors and being able to successfully secure the funding and implement other projects besides the existing project. So that has been very evident in that particular aspect. Then how is Charter for Change applicable to SBCC? Now, these Charter for Change, through the emphasis, emphasizing the critical role of local actors in shaping communication strategies that resonate with the communities. Okay, and then this is basically taken in consideration that the formative data that you collect when you're designing a program within a particular community is a representation of the needs of that particular community. Okay, so a locally led SBCC model is one that supports shifting power, and then of course bringing on board communities to co-design with the international non-government organizations and lead campaigns that are culturally relevant and impactful. So allow me to touch very briefly on the Grand Bargain. It's also another localization framework which focuses on improving efficiency and effectiveness of humanitarian aid. So, so one of its key commitments, the Grand Bargain, is localization. The shift of power to the local actors from the, international non-government organizations, which aims to allocate at least 25% of funding to local actors. So there are 10 work streams which are under this Grand Bargain. So there are two that are very related to locally driven SBCC approaches. There's work stream 2, which speaks to more support and funding, for local and national respondents. And then work stream 6, which is speaks to participation revolution that places affected communities at the center of humanitarian decision making. So it's very important that even when you're designing SBCC programs, we ensure the needs and that particular community, they are very central in the design of the program for it to be very successful, and the communities can actually own and identify with it, that particular intervention. And then how does Grand Bargain interlink with the SBCC programming? It highlights the importance or the imperative of local ownership in humanitarian response. And in this, it brings into light, local-led SBCC approaches where the strengthening of the capacity of local organizations, through co-design and delivering of communication strategies that are actually, responding to the needs of that particular community. So SBCC aligns very well with the localization agenda within the Grand Bargain, which is a global localization framework that is currently existing and is guiding program implementation, within the communities that you're working in, in the different countries you're working in. Now, I want to highlight briefly very practical, lived experiences of on localization approaches in SBCC in Africa. I'll pick one in Kenya. And this is particularly, there's a particular organization in one of the counties in Kenya called Machakos County. It's called Blink. Blink is supported by Care International in Kenya. And through the support of the INGO, they've been able to work with the community leaders to develop messaging and strategies which focused particularly on financial literacy, savings groups, and entrepreneurship. And Blink, just to give you a context analysis, it's an organization which focuses on people with disabilities and particularly impaired vision focusing on 3 counties in the country, which is from the part of lower eastern Kenya. So, dealing with the needs of people with impaired vision. And they were able to be supported in their capacity in developing strategies that were able to, pass information about financial literacy, savings groups, and entrepreneurship, through local media stations, storytelling, to reach women, and particularly in rural areas. And then, what was the impact? Through that support, there was 50% increase in the number of women participating in saving groups. So this is very, it's very commendable. Having this kind of group being able to fast track locally driven approaches in SBCC, within the rural areas, and particularly targeting women. So being able to engage in savings and small businesses set up. Then of course the women were also reporting improved decision making regarding household financial management. So sometimes it's very difficult to participate in decision making when you're not contributing financially, and even at the household level. So it becomes a little bit of a challenge. But then from this engagement, we saw an impact that women actually reported they were also now participating in decision making regarding household financial management and an increased sense of economic independence. So that is one of the case studies. So I will skip that. Let me highlight something else, which I was particularly one of the technical leads in the process of this process. So we started this process in 2010, 2011, 2012. This was a public health related interventions, which were driven by Ministry of Health in Kenya. And it was particularly the need to appreciate the local interventions in the space of behavior change in the country. So at that time, we had very many organizations implementing very diverse interventions, targeting different, cadres of people within the community. So there came a need to bring all the interventions under the same umbrella. So that's why we came up with a term which was called Kenyanization. Okay, so adapting even interventions which were coming from the global north to the local context within the country. So one example is that it was this intervention which I would call Healthy Choices Program, which was targeting youths aged 10 to 14 years on raising their awareness about sexual risks they face today, improving their sexual safety by identifying risk settings and enhancing communication. So what we did is that there was a technical group which was formed to review the intervention as it were previously. It was adapted from the US and then to the Kenyan context. So from what you're seeing from the screen on your left, it was the initial intervention, and currently how the intervention looks after the technical working group was able to work on it and Kenyanize it and localize it. And there were 2-3 areas that I would bring on board. One, the previous intervention, as it were, it lacked what we call driving demand for seeking for biomedical interventions. For example, this is a behavior change intervention. So the need was, how do we link this intervention to other interventions, and particularly biomedical interventions? And here I'm talking about seeking for HIV testing and counseling services, psychosocial support services, and what have you. And then the other thing was contextualizing some of the role plays and case studies within the intervention. Then the last thing was actually, ensuring that it was culturally sensitive to the Kenyan population. So those are the three key areas that we looked into when we were reviewing that process. And then we came up with this tool, which is still in place, the Kenya HIV Prevention Intervention and Assessment Tool under the Ministry of Health. I'll bring up something about Nigeria, about maternal, because I can see time is really running out, on maternal and child health. So there was this research which was done about, it was actually an evaluation of a program being implemented in Nigeria on community capacity strengthening approach. So I'll just highlight something which came up from the study, and there's a link to the study that a lot of, the respondents, one of them, highlighted that the messages that resonated most with the program participants were most related to child spacing, followed by antenatal. So this program was actually, implemented based on locally driven approaches in SBCC programming within in Nigeria. So there's a whole lot of information around this program. If you come from Nigeria, from within the country, and you'd like to have a look at it, it's available online. And then briefly on peace building in South Sudan, the deployment of focus group discussions in that particular community. And then, there was also that feeling of, confidence in the ability to resolve disputes peacefully within that particular community as a result of the SBCC program that was being implemented. So those some of the successful case studies that I was able to bring on board. Allow me to highlight 2 or 3 trends. One, of course, increased emphasis on localization. And this basically tailoring the messages to local languages, cultures, and context to ensure they resonate with the target audience. And then let me highlight technology, very important. We all want to agree that technology or social media has been a very powerful tool in passing information. So this is also just bring on board that as you're also designing the SBCC program, it's also very important to appreciate the powerful social media space that we have, that you can actually deploy, to change the communities that you're working in. And then, things to do with the recognition of indigenous knowledge, very important. And this is basically appreciating that local actors also have, particular knowledge that may not necessarily be what, the international non-government organizations may have. But once these, that synergy of, co-designing and, working together between the two partners, then the response becomes more effective and more, more long-lasting and more sustainable in the long run. Then collaboration and networking, and this is talking about cross-regional learning. Like, for example, this webinar is actually creating that platform for cross-regional learning, where, different practitioners from different countries in Africa, they're able to share learnings and experiences. Yeah, so looking into the future, there are 4 things. One, strengthening the capacity of local actors, very important, and clear definition of the role of donors and NGOs in the space of SBCC. Then sustaining the gains, of SBCC efforts within the community, and then how do we scale ownership? And this is basically through funding and capacity strengthening initiatives that are needed to empower local actors to design and implement SBCC campaigns. So I know time was really not on our side, Sheilah, but I'm glad that you've been able to have this conversation. So it's open for question, answers. I'll be glad to take any question that comes on board. Thank you.
Great. Thank you so much, Brian. It has really been interesting, especially appreciating the different case studies that you have provided for us. So I believe now is a good time for us to ask questions. So if you have a question, please just raise up your hand, and then I will give you the rights to be able to speak. so that now you can be able to ask a question live. In the meantime, I have a question for you as they raise up their hand. And just to clarify, we'll be sharing the PowerPoint presentation and the recordings for the session by close of business tomorrow. So don't you worry, Dahir. We will share them by tomorrow. Then there's a question from Praise. Hi, I'm Praise from NCDPZ in Zimbabwe, sorry. And would want to know the best approach to utilize when engaging a society where persons' disabilities are still hidden in homes, especially in regards to SBC on sexual and reproductive health. How best can she engage the society?
Okay. Is there another question? I can take that. Let me write it down and then I can respond.
Okay. It's on chat, so you can also check it out. I don't know. Do we have a question from the people? Yes, I'm having Dahir. Let me give you a chance to speak. Dahir, you can unmute and ask your question. Dahir, please unmute and ask your question. Yes,
can you hear me?
Yes.
Okay, thank you. I came late, sorry.
It's okay.
I haven't know much about the topic, but can we get the PPT of the topic?
Yes, definitely. We will be able to share with you the PowerPoint presentation and the recordings by close of business tomorrow. Don't you worry.
Okay, thank you.
Welcome. Okay, I'm having Praise. I want to give Praise a chance to speak as well. Praise, you had a question, including the one that you just shared on Q&A.
Yes, thank you. Am I audible?
Yes, you are. You are.
Okay. So sorry, the name is Fred, but it was you. But anyway, yeah. So my question was in regards to the social behavior change. I had indicated that we personally are having a project on sexual and reproductive health programming, and one of the challenges we've been facing was that most of the young people with disabilities are hidden in homes, and whenever we want to have the community engagement, you find that it's very difficult for them to come through, even their parents to come through, because they have this social stigma. They are afraid to come out because of different social norms that tells a person with disabilities as asexual, or even a person with disabilities, maybe their families having done something to ensure that the child has a disability. So they tend to hide and not be part of this community engagement. Sorry, am I still audible?
Yes, you are. You are, Praise. Thank you. Thank you for your question.
Great. So, yeah. Okay. So I just wanted to find out what would be the best strategy
for that. Okay, I hope. Good. Brian, I hope you've had the question.
Can I respond?
Yes. Yes, you can respond.
Yeah. So this is from which country? This is Zambia or
Zimbabwe?
Oh, Zimbabwe. Thank you. Yeah. So this question actually comes up in many times in different forums, and this is probably just to re-emphasize the need to to address the issues of around stigma in disability, around people with disabilities. So one of the key things that I would like to probably propose and encourage is addressing the myths and misconceptions around persons with disabilities. And this is basically through public awareness sessions where you can create SBCC campaigns that challenge and actually debunk harmful myths within these particular communities and misconceptions. And there's always superstitions around disability, and that's why you see a lot of different communities do not want their disabled kids to be seen by other people. So there's always a lot of misconceptions, superstitions around this. So my encouragement is for that particular program, that team to to consider creating an FCCC response, messaging to address the myths and misconceptions within that particular community. And then also even when you're designing the SBCC programs addressing that particular community, you can also integrate things to do with empathy and understanding. So sharing stories, during the training sessions that you're having, and then of course, inclusive language. When you're dealing with people with disabilities, and then things to do with role modeling. It also works very well when you have person with a disability from a particular community who has gone through the system, being able to succeed probably successfully. So that person also can also help so much in giving feedback and being able to support the process of the SBCC programs that you're actually designing to respond to that particular need from that particular community. So yeah, so this is not just for a Zimbabwe problem, it's a problem that is a cross-border problem. So thank you, Sheilah.
Good. And I have some few questions on Q&A. I believe you can see it. So if you're able to answer them there, that would be good. But then Yakubu is asking 2 questions. What monitoring and evaluation methods can I use to assess the effectiveness of SBCC? And secondly, how can one plan to engage the community in the design and implementation of SBCC activities? I feel like Yakubu should attend our SBCC. Anyway.
Sorry?
What do you think, Brian?
Come again?
What monitoring and evaluation methods can Yakubu use to assess the effectiveness of SBCC? And how can one plan to engage the community in the design and implementation of SBCC activities?
Okay.
Yeah.
I think I've gotten the question. So yeah, let me start with how to engage the community.
Yes.
Different communities have, like for example, we shall have, like in some of the communities in Kenya, we have annual events, for example. And I can give you an example of initiation ceremonies in Western Kenya. So if you have a program within that particular area that is talking about health education, so if you can actually plan in mind with that particular calendar day or calendar event to be able to work with the planners for that particular event, and being able to integrate the SBCC messaging that you want to pass across to that particular community and targeting the already existing community structures within that particular community. So it's very important. As I also saying, it's about localization. It's appreciating that these local communities also have their own structures, and so we're able to get on board these structures and work with them because they themselves have actually existed within those structures for many years, and it's also a good reflection that it's an appreciation that they actually have the capacity to give you the platform to engage and deliver the SBCC messaging that you want to deliver. So that's one of the ways that they can actually, bring on board that kind of programming. So M&D, the second question was M&D.
Yes, yes.
Yes, so one of the ways you can successfully conduct M&D for SBCC is basically when you have very clear M&D objectives. Okay, so that's one of the strategies, because you cannot monitor and evaluate an MBCC program that you do not have the clarity of what objective is it responding to. So there has to be that clarity, and then you must also identify what are the key indicators that you actually want to monitor and evaluate, so that during the implementation phase of the SBCC program, then you're monitoring the program along the indicators of the program, so that if there's anything that is not going right, then you have space to bring it back on board, and then up to the end of the project. And then when you're evaluating also, so you also have the key indicators that you developed at the point of the inception of the SBCC program. And yes, so I would respond it up to that end.
Good. I think we are okay with that. So I know time has so much gone, but then I would want you to just answer 2 questions, and if you can do them concurrently, it would really be appreciated. So is there any model approach to assessing SBCC? I know there are quite a few. So for Papulo is asking, is there any model approach that you can use to assess SBCC? And Liz is still struggling to understand the difference between community engagement accountability and SBCC. At first, she thought SBCC was a way of measuring impact that all interventions have led to a change in behavior. But from the presentation, there seems to be a lot of similarities between community engagement, accountability, and SBCC. How can she be able to differentiate between the two?
So differentiating between SBCC and
Community engagement.
Community engagement.
Yes.
Okay. So actually, community engagement is an approach under SBCC. Okay.
Good.
So, yes. So it's as clear as day and night. Yeah? So you're talking about localization. It's about engaging the local community. Okay. So, and this is you're engaging them at the local level where they meet and where they interact. Okay. And then SBCC, of course, it's you're talking about social behavior change communication, and this is basically influencing behavior change through communication. And this communication messaging is designed based on formative data that you've actually collected with the help of the community. So community engagement is very important from the point of the inception of the SBCC program up to the point of implementation of the SBCC program and up to the end of the evaluation process of the SBCC program. So yes, community engagement is actually an approach under SBCC.
Nice. And what of any model approach that you could advise to assess SBCC?
Yes, of course, there are several. One, of course, you can use the logic model, which I think different programming people use. And this is basically, it's a visual map. A logic model is where you're linking the resources or the inputs of the project, how they support the activities for the project, how do you, the path towards outputs, and then the outcomes of an SBCC initiative. So the logic model is one of them. Then you can also use the theory of change. And the theory of change is basically, the map, which it's a visual map which outlines how the desired change is going to be achieved. Okay. Yes, and then there's also a new one, which is it's a methodology which is coming up. It's called outcome harvesting. And I know majority of people probably they have not implemented it. Probably they're trying. Outcome harvesting basically means you identify a particular outcome which has actually been, experienced or achieved within a particular community, and then you want to map what has led to the achievement of that outcome going backwards. So you're going to identify what has led to that particular outcome. And ideally, this is a qualitative process. So it's a qualitative data collection process where you engage at the key informal interviews or at the focus group discussion level. So this is purely about qualitative data collection. So that's another approach that can be deployed. Yes.
Good. Thank you so much, Brian, for that. And I believe this marks the end of our webinar for today. Please, if you want to learn more from Brian and on just areas surrounding SBCC, kindly just get in touch with us, and we will be able to support you. We'll have various engagements with him in the month of October, and I do hope that you would register for the training so that you get to pick Brian's brain in anything and everything to do with SBCC. There's a link that has been shared on chat. Please, if you're interested in this topic and anything that surrounds SBCC, kindly click on that, and we will be able to get in touch with you on the necessary steps that you need to follow. With that, allow me to end the session from there, wishing you all a wonderful time, either morning, evening, or afternoon, depending on wherever you are. With that, allow me to bid you farewell and looking forward to seeing you next time. Bye-bye.
My name is Chepkwony. I'm the Operations Director at Beam Children's Foundation, a non-profit organization working in Tarbo, Eldoret, Kenya. We provide educational scholarships and mental health counseling to vulnerable children in the slums within Tarbo. I learned of Humanitarian Global through a friend and wanted to do a training on leadership and project management. And I got a chance to attend a 4-day training on project management, and I've learned a lot. My take home would be the change management and communication that I intend to put into work once I get back to my workstation, and see to it that this improves the services that we deliver to our clients. Thank you.